So Nicole, welcome to an episode of Dynamic Dialogues. We are so excited to have you. So a bit of background on Nicole Taylor. Nicole Taylor is a doula. She was also my doula and childbirth educator. And I'm so grateful for everything you've done for me. Like, I had a dream birth, alhamdulillah, mashallah. You know, it was an experience I would love to repeat. Mm-hmm. And it was all thanks to you, even though you weren't physically with me, because you were here in Bahrain and I was there in the US. But still, like, just having you on the phone in early labor, that made a huge difference for me. And then I was lucky enough to have you as a study buddy on the Body Ready Method course. And that was an incredible experience as well, because, I mean, you've got, 25 years of experience as a doula?
Basically, yeah.
I think it's more.
So I got interested in birth as I got pregnant. And then, I think that's the normal case. And I was petrified of birth. I didn't know anybody having a good birth. Around me, people were having really kind of horrible births. Yeah. And I ended up I took a course in America that helped me, but I still didn't know if I could do it. And then
you mean you couldn't do?
I just didn't know if I could
birth, like when you were pregnant.
Okay. Like, I just didn't know. I don't feel like I am. I'm not the person that's going to go do Ironman.
Yeah.
And I didn't feel like I was like, oh, that
you were physically ready for the birth.
Must be so hard. It must be so difficult. And people I were hearing had kind of some traumatic
experiences, birth
and
stories.
Yet I feel like there was a part of me that, people ask me now, like, oh, what's your philosophy of birth? I didn't have the words for it then, but in my mind, I kept thinking, everyone's treating you like you're sick, but I'm not sick.
Yeah.
And I was like, this is normal.
Yeah.
So that put me on a journey.
Before we get into all that, I would love for you to tell us, what is a doula?
That's amazing. Okay, so a doula is a birth coach.
Okay.
So it's kind of like getting PT to help you for life. So it's emotional and physical support to prepare you for birth.
Okay.
It is not a midwife. So a doula doesn't do like medical checks, but they do a lot in helping you mentally and physically be ready for birth, and specifically in the birth. So there's also a different type of doula that might help people postpartum, but I am a birth doula.
You're a birth doula. Mm-hmm. So we've got a whole bunch of questions from a few of our viewers, starting with, let's see. What role does a doula play in supporting families during labor?
I love it. So a doula, and I guess it's kind of like saying about even someone who's a doctor or a PT, they're all different. Yes. And they have personalities. So I'm going to give you the overall mine.
Right.
I don't think a doula should take over. Mm-hmm. A doula should be a part of your team. Mm-hmm. And so, I mean, when I smile, and a number of my clients, we just kind of all know, I mean, even how we worked together, you have that sense of teamwork. So a doula should come in, and they might bring, and I bring in, I've been in a lot of births, so I bring in some expertise. I've taken a lot of different courses, so I bring in some skills. I've actually purchased certain things that I might use in labor, but I am not like their husband who knows them. Yeah. And the husband knows their history. They know how to support them. And so when we can come together and be a team. Now, I also have had a mother or a sister in the labor room. It doesn't just have to be a birth, like a husband. But, and I've also
to
been
give them that emotional support they need.
Yeah. And in many ways it is. People don't always think about what labor might be like. You have nurses and doctors coming in and out of the room. But when you have a doula, it's like, it's having someone on your team that's for you.
Yeah. More like an advocate.
Yeah.
Yeah. And so what's a doula's role before, during, and after labor?
Love it. All right. So before, okay. You said, I'm a doula, but I'm also a childbirth teacher. So a doula, the way most doulas do it is they usually meet with the client about 2 times before they give birth. And that's a lot of it, like, to kind of go over the details. How am I going to do this? When do you call me? When do I show up? And I give some basic parts of birth. But I really recommend that people take a course. I teach classes.
That's what I did with you.
Yes,
actually.
exactly.
Yeah.
And it really helps physically and mentally. But so a doula does still help. Now, in labor, how do they help them is a lot of women, they just aren't sure if they're in labor. So it's funny. I end up doing a lot of just communicating. Like they're giving me like, I'm having this weird feeling. I'm having this, just being there. And I think a lot of people, it's just nice to, again, having someone
to hear you, validate how you feel.
Like, is this normal? And it doesn't mean they can't call the doctor. I would, if it's something medical, of course, I will refer them. Yeah, this sounds like something you should mention to your doctor. Other times it's just letting them process like, yeah, that makes sense. It's a big event that's coming and you're nervous.
Yeah.
And then once the birth comes, when they're actually in labor, early labor is a very shy thing. And it's almost like being over-observed and overwatched makes that labor tend to stop and stall. But so I always tell my clients.
I do want to pin that because I think that's a very important and
it's very, very
deep topic.
It is.
That I do want us to get into.
Yes.
Continue.
And so this question we're answering though is what does a doula do there? So a doula, you want them when you need support. So then I show up and a doula would be with you until the baby's born and usually about an hour after the baby's born. And then I'm leaving because I want them, this is their baby being born. They're bonding with the baby and their family. And then after the baby's born, I go and have one visit with the family afterwards. And I refer to help. Like, so I have breastfeeding specialists that I recommend, pelvic floor specialists, so I'm also just a voice. And again, that's a lot of times, another space of connection to ask them.
Yeah. There are postpartum doulas. I think not here, but in the States.
There are, but
and here, what do they do? Just out of curiosity.
Yeah, so out of curiosity, I think a lot of time a postpartum doula in the United States and the UK will come by for a few hours and maybe hold the baby while you take a shower because a lot of people are just overwhelmed. We do have a few benefits of just a closer knit culture in Bahrain.
And also we have domestic help.
And domestic help can help. But it doesn't, there's a role, but it's, you find nurses here that do that job as well.
I think in my case, when I was in the US, postpartum, I got a breastfeeding lactation consultant. And she was also a postpartum doula. So she would hold the baby while I took a nap or showered, or she would help me while breastfeeding.
Yes.
She'll, help the position of the baby and all of that. I remember the funniest thing she did was we had a whole bunch of diapers that we weren't using. And she said, you know what? Give them to me. I was like, what do you want to do with them? So she soaked them in water and then she put them in the freezer. And then she said to me, if you're feeling any pain, sometimes putting a frozen diaper on your boob would help. So I actually did use them and they were great. No way. But obviously we mixed up heat packs and like cold and hot therapy. But yeah, that was very useful. I do want to go back to the time we worked together because I think I would like us to kind of explain how we worked together, how you worked for me as a doula, how it helped me, and hopefully that would be helpful to our viewers as well. So basically, when I first had our first session together, it was my husband and I with you, and you explained to us everything from A to Z. The anatomy, the process, what happens to my body, what's happening to baby, what I'm supposed to expect, early labor, little tips here and there, what happens to my body during birth. We also highlighted things like oxytocin and how that aids the delivery versus adrenaline and stress. And I thought that was my biggest takeaway.
It's huge, isn't
that
it?
was 100%.
I think, I'll just go there for a second.
Yeah, please.
I think a lot of people we hear these words like, oh yeah, you need oxytocin. Oxytocin is the kind of the miracle, it's kind of called the love hormone. And it's actually what starts labor.
Yeah.
But just the quick, I love this, is that oxytocin flows on the same synapses in your body as adrenaline. So adrenaline is that powerful when you're stressed, when you're fearful, when you're excited. And so that we talked about early labor.
Fear as well.
So fear, stress, and excitement. That actually blocks oxytocin.
And when oxytocin is blocked, it's going to block contractions
so
and progression into slow down the labor.
So it's a very interesting thing because there's a lot of women, probably first-time moms, And not everyone's going to come work with you or me. So this would be a tip that, is that early, a lot of women, the moment they think they're in labor, they run to the doctor, run to the hospital.
Yes.
Where a lot of early labor, one of the best things they could do is slow down.
Right.
Relax. Their body's trying to get going, but we start to get excited or stressed or fearful. And then the only other option medically, and this isn't to blame hospitals, it's just that they don't have time to let labor go on its own. And they have medicines that can kind of try to mimic. So we have oxytocin. Naturally, that's what our body makes. But medically, we can give somebody Pitocin that can mimic it. Yeah. But that does not release or affect the hormones. And we are a really amazing, complicated part of our body. So, we go over those things. Yeah. So I would love if people would walk away and go, I took a tip from there is early labor. We want oxytocin. So if we can, like as you were saying, if we could relax, and those are things both of you and I teach to our clients.
100%. So yes, I remember clearly when I went, I left when I was around 32 weeks.
Okay.
And I think it was 37 weeks and 2 days. I remember I lost my mucus plug. Now, for our viewers that don't know what that means, please explain what that means.
So just at the bottom of your pelvic floor, there is kind of like, it is like a plug. Okay, so some women know it is and see it. Other people, it comes out real stringy. And that'll come out anywhere between the day of your birth and even up to 1 or 2 weeks before. But there is kind of this discharge, and you're like a little bit of fleshy.
Yeah, and bloody.
A little bit bloody.
Yeah, because it felt like I thought it was I got excited.
Yeah.
I was like, whoa, this means I'm going to labor soon.
It's a great
I did not want to go past 38. I was like, no, I don't. This is 37 weeks. I'm done. Can we just get it done? I want to meet my baby already. But yeah, so 37 weeks and 2 days. And I called you and you said, okay, anytime now, up to 2 weeks. You never know. Just keep an eye on it. Relax. And I did that. I remember calling my husband and saying, hey, I think I'm going into labor. Get on the next flight. And he did. He did. And then it was literally 37 weeks and 6 days. He arrived.
It actually gives me chills to just think about it.
Yeah, it was such an experience. So, and I remember we also talked about water breaking. So in my case, 37 weeks and 6 days, 7 days actually, I was with my husband. I was like, hey, I want to go to that bakery. I was craving something from that bakery. And lucky for me, it was close to the hospital. And I was in the car and all of a sudden, I'm like, I felt like I was peeing myself, but I couldn't control it. And it was a lot. And I'm like, I'm not peeing. Am I peeing myself? Am I not peeing myself? What is going on? And we were parked, thank goodness, because it was my sister's car. I'm like, I do not want to mess up my sister's car. So I literally got out of the car and I'm like, it's not stopping. And I got excited. I was like happy. I was like, oh, I think my water broke. And I was so glad my water broke because I actually feel for women that have an ambiguous water breaking because it can be confusing. And I want you to kind of, as I tell the story, I do want you to come in.
I'd love to just
add that.
I mean, I love this story. It is yours and it's beautiful and it's real. What's can be confusing for some women is we see this a lot on movies. I know yours wasn't horrible or
no, it was
freaky.
great.
It was amazing.
It was great. I knew what it was. I was like, my water's breaking. I'm going to call the hospital. And they just said, just come to triage. I was like, okay, great.
Yeah. So, I mean, the thing is that a lot of people see this and they're actually, I have people that are afraid, like, I don't want to be out in public. I'm afraid my water will break. So one of my first statistics I'll tell them is just know that only 25% of labors begin with water breaking.
Oh, I did not know that.
So you are in a very small percentage. So a lot of people think that. And I mean, again, I agree with you that it's kind of helpful to know, but there actually is a lot of value.
Can that be genetic?
It can be, actually.
Okay.
But then there's some different reasons. I mean, it also can be an active baby.
Okay.
There's a lot of reasons we don't know. I mean, I had one with my water breaking like that and the rest that didn't. Oh. Now there's reasons actually as a doula that I love when water doesn't break.
Oh, really?
Yeah, because think about I don't have my rings on right now, but if you have a ring on and you can't get it off, just a little bit of lotion or water brings that lubrication. It stops. So water, we got my little, you and I talk about like the pelvis being so bony structured.
Yeah.
Well, water is that extra little lubrication.
Ah.
So I really love when a woman's water hasn't broken.
Oh, interesting.
Yeah, because it doesn't make it easier.
I mean, for you, but for a woman that's giving birth, it was a tell.
Right, it's a tell.
Yeah.
But it actually can ease labor, which that's what's so hard for. No, meaning ease it to have the water. So
to have the water, not for it to break. Oh, interesting.
Well, I mean, these are interesting things, right? Because I don't want people to freak out like, oh, my water broke. One is, I'll just quickly say, your water doesn't run dry. You mentioned that. Mm-hmm. Actually, it will keep replenishing.
Yes.
So a lot of people have this false belief that, oh my gosh, if my water breaks, this poor baby doesn't have any fluid.
I used to visualize, the baby kind of, the amniotic sac just kind of depleting, and the baby going, I need water.
Love it.
Like the opposite of drowning. And that's what before getting pregnant, obviously that's what I thought.
But I'll even let you know there's you might even find someone in the staff, not saying all the doctors wouldn't say this, but they know that if a woman stays hydrated, if a woman stopped drinking, I mean, your hydration is incredibly important. You know that through life, through pregnancy, through birth. But if a woman's water is breaking, I'm telling them, stay hydrated. Let's see what happens.
Yes.
So it just wanted
to
stay
hydrated during the birth.
Well, but especially.
Are you talking about before?
Always. Always. Okay. But I would be extra thoughtful and aware if a woman's water is broken.
Yes. Yeah, I recall I usually struggle with drinking water, but like during pregnancy, I made it a priority.
I didn't remember that.
I had my electrolyte and I aimed at 2 liters a day, even though sometimes, I had to drink a little more, but I was like at least 2 liters a day. And that made such a huge difference. So every time I went for my checkup, the doctor was like, okay, fluids are good. And that made me feel like, okay, I did my part.
Absolutely.
So good to know that and sometimes I remember you mentioning as well that the baby can be born within the amniotic sac.
Yeah, it's really rare, but they can be.
Okay.
Which is amazing.
What kind of birth is that? There's a name for it.
There's a thing called a big birth and call. It means that the baby's born in the sac. And now these days on YouTube, you'll see it more often, like from a C-section, because they can actually very gently just completely remove the baby out in the sac. And so there's a lot of videos online. But I've actually seen a baby come out in the sac and then pop right out at the end. So it's really amazing.
Wow.
But nonetheless, in that sense, they're completely warm and they're in their little like extra cozy, perfect temperature bubble.
Nice.
Yeah.
Nice.
But that birth has a design and a plan, and where it happened with you was still perfect, and in many ways perfect for you. Mm-hmm. Your body was just on cue. Yeah. Do you mind if I say one more thing? We'll go back.
Please.
I love what you said, how you said you're at 37 weeks. I mean, a lot of it people will hear about, what's your due date?
Yeah.
And so Esraa was before her due date, but the due date is not like a payday. Mm-hmm. And you're not late.
Or early. Well, you are early.
But, okay. The WHO has said that your estimated due date should be anywhere between 37 and 42 weeks.
Okay.
So just like
I was
fruit,
early then.
Yeah, you're right. So just like fruit on a tree, not every apple will come on the exact same moment. But we kind of know that, this is the season when the berries come out, or this is the season of this fruit. That we know that that's about the time.
It's not an exact science. It's an estimation.
It's an estimation. And basically when a baby, and you were right in there. So basically your son was ready to be born because he was fully developed. It was
37 weeks and 7 days.
So you were right in there.
Shy of 38 weeks.
No, but there are some people, and this is probably much more of a genetic thing, that it's helpful to know if everybody in your family, like you're like, my mom had her babies at 41 weeks, that tends to be a very strong genetic line if people are having babies later or early.
Oh, interesting. Mm-hmm. Wow. So then the water broke.
Mm-hmm. Yeah, go back.
And got to the hospital, and I had your voice ringing in my head. My husband, tried to valet the car, and then as I got in, the lady was like, "Would you like a wheelchair?" And I was like, "No, I can walk. I'm fine." And I remember you saying clearly, this is an athletic event.
Yes.
If you look at it as an athletic event, you can handle it like an athletic event. And I did not want to, from the get-go, to tell myself or to feel like I'm weak, or no, there's like you said, like it's a sickness. It's not. I'm not sick. I'm not sick. I'm not tired. No, I'm about to do something, and I need every fiber of my being to be present
Yes.
and alert and awake and looking forward to this. So I said, no, I can walk. I'm fine. And I kept walking. Of course, my Birkenstocks went to hell with all the water. But then I got to the hospital, and I noticed certain now that I know what I know from our training, I did a lot of very intuitive movements, like, the side to side movement, the hinging movements, and all of that. And I noticed that I don't even know why I was doing it. I was just doing it. Like my body was just telling me to do it. So then I got to my room. And just to clarify to the viewers, I gave birth at a birth center that was in a hospital. Okay. So a lot of the medical protocols did not apply to me within the birth center, but in case of an emergency, they'll just take me down the hall to the hospital. So it was,
which was amazing.
Yeah. And that allowed me to have the kind of space, room, environment I had in my birth plan. So when I got there was a tub in my room, a very comfortable bed, beautiful dim lights. And it was just me and my husband at this point. The nurses weren't all over me. It was like any other day. No one was making a big deal out of it.
Which is amazing.
And I felt great. I just felt like, oh, okay, everyone's calm. I felt calm.
You were doing a real life event, not an emergency medical procedure.
And it was just so funny because you can see the difference in the attitudes from the staff right at the front at the hospital and where the birth center and the OBGYN clinic was. The nurses reacted differently, everything. So, because when I walked in, obviously the first thing that I was asked was, would you like a wheelchair? But then when I said, no, I'm fine. And then the second they, moved me to the birth center / OBGYN clinic, the attitude was very different. They were very calm. Nobody was rushing me anywhere. Nobody asked me if I needed a wheelchair. They just walked me to my room, and they're like, okay, this is the tub. Just, do your thing. Which I thought was a little weird. I was like, okay. But at the same time, I'm like, am I supposed to do something? But at the same time, I was like, you know what? My water just broke. It'll be a while. Because you hear all these stories about how it's going to be a while. And
do you mind if I?
Please.
Yeah, so just one thing I want to say again, what I think is powerful that people could walk away with your story is just when a woman feels comforted, safe, protected. So you had a birth partner who, your husband took a class with you. He
did.
Checked in and he was present.
Yes.
I know you. You actually were physically active, but you weren't aggressive. Like you did very normal. Like I know you were walking and doing things, but I think that when you talked about like your body just started doing things, that happens when a woman feels safe.
Yeah.
So when a person is feeling fearful and afraid, they tend to have less instinctual movements. So like and that you chose a center. So finding care that makes you feel safe. So if you have a doctor who kind of makes fun of you, like it belittles you or like, don't worry, I'll take care of everything. You need to know yourself. If that makes you feel great, then that's good. I would say about 30% of women, that makes them feel great. But I think a lot of women, they feel out of control. So I really feel like you chose people that believed in you and said, hey, we're here if you need it.
And I needed that. I really did.
But you chose it, and that made a difference.
Yeah, and I guess I was also lucky because I had the means to get the birth, to make certain choices for myself. And unfortunately, some women don't have the means to do that. But so when I was left in the room and I started to get more intense surges I remember, actually, you know what, I'm going to keep making stops here because I feel like this whole story is really a way to exhibit the things that you taught me, and I want you to kind of address them in detail. So one thing Nicole mentioned to me is language. Use your language carefully. If I would have said, more painful contractions, I would react differently to using a word that I felt safe using. So can you elaborate a little bit on that?
Absolutely. Thank you. So it really is amazing. Like if you use like, I'm feeling really strong sensation right now. Or if I say, this is so painful. Like our body really responds. Because if right now I said to you, Esraa, are you feeling any pain in your body?
It feels different.
That word pain, you just did a scan down your body. And maybe you said, my shoulder's a little, or maybe my hip. We naturally from our words have this a physical effect on us. But if somebody came into you, your nurse, your husband, and said, are you comfortable? How can I get you more comfortable? So that word, it's like a target towards your mindset. In the same way, some people are like, who's going to deliver your baby? And I will always tell women, you're going to give birth to your baby.
Yes.
And so in the same way, it's not that I'm afraid of the word contraction. In the training that I've done in this kind of mindset and really training your brain, contraction, it can be a okay word. But also I might personally use the word like a wave because I like the idea of a wave that it builds or a surge. And these are just ways to choose your vocabulary. But I love how you said, like, if you had been like, this is painful. I mean, you and I both enjoy a good workout, right? But if someone walked into your gym and they're like, I hate this. This is going to be awful. I don't want to be here.
We get those.
Okay, but how does their workout go out? And if they're like, I can't, I'm so tired. I'm so tired today. I can't work out. And it's like, how's the workout going to go?
I mean, to be fair, like I've had days like that.
Okay. And it's true. Yeah. But if we, like I said,
no, but I'm saying I've had days like that and you can tell the difference in the outcome of the workout. Like the days where I've had that negative mindset of dragging my feet, my workout feels a lot more tiresome. I probably don't get as much in. Yeah. Versus when I'm in and I'm positive and excited, I'm like, yep, let's do this. I perform way better.
And it's hard because obviously the reality is you might be tired. It might be a little like, I'm scared or I don't know if I can do this. And that's why we try to come up with.
And sometimes you hype yourself up.
And then you have to say to yourself a few positive things. Like I love thinking, what are my favorite ones? Like I'm like just saying, my body was designed to do this. I am calm. I'm going to breathe in. I'm going to breathe out. Yeah. One breath at a time. Did you have any that you really kind of said to yourself?
So at the time, I wasn't really.
Which you don't. Did you do before?
I did. Like the deeper I got into labor.
Okay. Interesting.
So, oh man. So I started to feel,
contractions coming.
More contractions coming, surges. And I felt like, you know what? I asked my husband, I was like, can you fill up the tub? Because I remember one thing you told me was water helps just, manage these surges better, these contractions, or the pain management is better.
Yes, absolutely.
Okay? And it just helps relieve a lot of strain and it gives more comfort. Actually, the best way to describe it is water gives you more comfort.
It does. It's like it is. Someone actually said to me, water is like CPR to life. And if you think about just your aches, your pains, like getting in water and your body just can release and relax. So you chose a place. Now, a lot of women
like even when you swim, you're almost, you're defying gravity. You're just kind of, feeling a lot lighter. So yeah, sorry. You were saying.
So you chose a place that actually had a pool in it. But even if that wasn't accessible to you and you're hearing us and they're like, that's not available. A woman at home in early labor can get in the shower. And I'll tell them,
Can you describe how to safely get in the shower?
So you can get in the shower and you could even bring your ball. I mean, we could just.
What about a chair? Like, what about like a plastic chair?
A lot of people just stand and they'll lean against the wall. They'll put their hands up. They'll just lean against the wall and let the water go down their back. I've put a towel on the floor and let the ball, and some of them have leaned over the ball.
I see. Okay.
So the ball won't move because the towel's holding it. Yes. And then they can lean over the ball.
Right.
Because their legs might get tired. But you can get into a bathtub if your water hasn't broken. Like, so for, you were at the hospital, they were able to manage all this. But if you're in a non-trained, you had trained staff to watch this. But if a woman's water has not broken, they at home can safely get in a bathtub. I did that here in Bahrain when early labor, I was just like, oh, wow, this is starting to feel
Intense.
strong. So I just got in the bathtub, and I remember thinking, that just decreased that. I mean, I'm serious, like 80% went away.
No, I agree. That's exactly how I felt. So I got in the tub because I started to feel it a little bit in the lower back. And you know what they tell us as well in the BRM training, right? The sensation. So if we're starting to feel it more in the lower back, contractions moving upwards, baby was trying to get in the inlet.
Yep.
Right? And so I got in the tub, and I was on all fours for a lot because it was the most comfortable position for me. But then I also kept like rolling to my side a little bit within
the water.
Within the water, yeah, just moving to the side,
good.
like whatever it was comfortable. And then as the surges, increased, it was progressing pretty fast. I'm not gonna like sugarcoat it. But it got to a point where I had to zone in. So my doula, I did hire a doula there, and she did come. And I remember saying this to you. I said, she didn't do anything. She just stood there and like dabbed me with a towel. I could have done this all by myself. And then what did you say?
And I was saying that a good doula should be there in and around you. But if a woman is doing so well the way you were doing, actually what she did, and that was probably weird, is you're like, why didn't she do more? And I'm like, so I remember asking you, well, did she like get you water? Did she put a washcloth on you? Did she encourage you? And you were like, yeah. But I was like, because you were doing it.
Yeah.
And so it is weird to realize, okay, so sometimes when I'm there as a doula, I am really having to remind a woman to breathe because they start panicking or they don't zone in.
Yeah.
But I think like you really were in that flow state.
Yes.
You really moved into that place.
Right.
And so I think at that point, she probably just was like, Esraa's doing what she needs to do.
Yes.
Let's not mess up.
I mean, in hindsight, yes. She was great.
But it's still weird when you're thinking, why did I bring this person here?
Yeah. No, that's, it was interesting. So then my, contractions kept progressing pretty quickly. And one thing that helped a lot was the breathing. Oh, yeah. So I literally could, it's funny. I don't know if some people might relate to this, but when you're in it, everything's dark around you. And you're kind of, all I could remember is like a tunnel. And I was visualizing a tunnel. And it was weird. I wasn't consciously visualizing it. It was just there.
It was just there.
It was just there. And I was breathing. And it was very like vibrational breaths that were from a place deep, deep within. And it wasn't like a strainy breath. Yeah. And a few things I was very, the exercise physiology geek in me kind of kicked in because I did my homework prior. I was like, okay, release your jaw. Jaw's connected to your pelvic floor. So I kept doing this while I was on all fours. I was like, and I talked to myself. I'd be like, Esraa, yalla, just relax your jaw.
Do you mind if I interrupt you and just say that again?
Please.
No, I want you to say that again because some people may not. You said your jaw is connected to what?
Your pelvic floor.
So a lot of women don't realize that.
Yeah.
And so they are clenching and they're nervous. So, like you said, your physiology training brought you to that, but that's something really important that someone could take from your story.
Yes.
Because that's something we talk as well. But
yes, we did. So that was a big part. That was a big takeaway for me. So, because I caught myself straining and I did not want to waste unnecessary energy.
yes.
I was like, conserve energy, conserve energy, conserve energy. And that was my main, my mindset, like the big banner that, was kind of glaring at me at the time was conserve energy. So when I was on all fours, I was like, relax the jaw, relax the jaw, relax the jaw. And then I caught myself doing that. I was like, relax the shoulder, relax the shoulder. And this was in between the surges.
Yes.
Because you do get a break.
You do.
You do get a break. And I think there's a misconception that you don't get a break. There's a misconception that is just 12 hours of hell. And it's not. Or I don't know, 30 something hours for some women. So I feel, so I connected with my breath, relaxed my jaw, dropped my jaw down, relaxed my tongue, did a lot of this. And even within my like when I was breathing, is that who breath? It was like I'm not going to do it on camera. It was lots of roundness, like a round mouth, like a drop jaw, vibrational,
really deep breath.
deep breath, almost primal.
And I feel like it's important for people to hear this, that, okay, not everybody will do this. Some people are very vocal in labor, and some people are literally so quiet you barely hear it.
Yeah.
But one thing that
One of my clients actually was.
But
and she still did great.
yeah, and that was me. I was not vocal, which is funny because I'm so talkative. But the thing is that whatever you walk through from here is that, like what Esraa you were doing, was that you knew, like, to go deep. I think that there is a deep breath. If you think about when someone's scared or panicked, we always make that joke. There's that funny like story from Friends when he's like, I'm fine. I don't know why my voice is so high. You remember? There's this panic space. Okay, so
that was Ross.
I think it was Ross. Yes,
That's Ross.
But the thing is, in birth, there is trying to go low.
Yes.
Go deep. And then maybe you don't make a noise, but okay, you can always come back to your breath. You always come back to your breath. But what you were able to do, which I think is actually another rhythm tool, which is some people move into a movement that helps them get through it. Some people get into a sound. I think you probably did all three. I think you were breathing. I think you were probably moving.
I was.
And you were actually using
sound and vibrations.
And that's actually, these are some things I think why your birth went so well.
And oh man, I know some people go, oh my God, I'll never do this again. I was like, after the birth, I was like, I'm doing it again. Like, this is great.
Isn't that amazing?
But that being said, it wasn't easy.
No, it's work. It's not.
It's a lot of work, you know? And at some point, I was like, why am I doing this? I did say that. So there was at some, and then I literally slapped myself. I literally
Did you really?
I did.
No.
I remember I was still in the tub, and because I wasn't ready to push yet.
I knew that.
No, I slapped myself because again, I didn't realize people were around me. I was just there were like two nurses, a midwife, my doula, and my husband, and I would never forget this. Like, I can't do this. I can't do this, and I was like, yes, you can.
But I think that is interesting because you'll catch yourself. I mean, we've all done that. We've caught ourselves in a bad day. I'm so tired. And if you just sit here and you change yourself, like, I'm okay.
Yeah.
I have enough energy for today.
Yeah.
And I think and these are moments that if it's you or even a birth partner, because as a doula, I've caught people saying, I can't do this. I can't do this. And then I'm like, you are doing it. You're doing this.
There was a lot of support. Like when it came to pushing. So I felt 2.5 hours after my water broke, I felt the need to push.
Amazing.
And I was like, I need to push now. And I was like, and there was no one in the room. It was just me and my husband. I was like, call someone now. I was like, I need to push. So he ran outside, found somebody. And of course, the nurses were super chill, like, which I'm very grateful for. So they walked in, and she walked in, and she's like, you know, are you sure? I was like, call the midwife. I need to push now. So she did. She called, and the midwife came in, and she quickly just checked my dilation, which I want us to talk about as well. And I was 8 centimeters dilated and needed to push. And she's like, okay, let's get you out of the water because hospital policy is that you can't deliver in the water. So I got up, and the first thing they made me do was to open the mid-pelvis. So they had me do the lunge rocks while standing, which was quite painful for me at the time. Because again, you're going from water,
which you basically had
gravity.
You basically had pain relief.
And then all of a sudden I came out and I'm like, I felt everything. Wow. But then I had to do the breathing again. And so let's talk about dilation versus station.
Okay. And I just want to go back on that one that you just said, is that I will tell people, and if you just hear from your story, that you kept coming, like something may happen in birth. You had to get out of water. Maybe that's not going to happen to someone, but something might happen in your labor that gets you out of flow. It gets you out of it. And you said, like, I had to come back. I had to breathe. I had to get myself, like, you can get yourself back and just like take a few things. And I always say your breath is like your right hand. Come back to it.
Absolutely.
And then come back to your relaxation and movement. Now, dilation is important. You'll hear that a lot. Like people are like, oh, how many centimeters is she? How many centimeters is she? But still, in many ways in the birth world, we say it's just a number. Because as you started to mention, one of my other trainings we talked about is, where is the baby?
Yeah.
Because if the baby's still really high, that's going to change. We want the baby to
engage with the pelvis
and go low.
Yeah.
And that's why moving and using gravity. So again, what do people see when they think of a movie they've seen of a woman in labor?
She's on her back.
She's on her back and in a bed laying down.
Yep.
Not using gravity. I mean, if you and I were in the desert, and I'm sorry to be, it's not crude, but if I had to use the bathroom in the desert, I wouldn't go, oh, hold on, let me lay down. Nothing in you instinctually would want to lay down. And so we've got to use gravity to help get the baby lower.
Yeah.
Now, there are stations of the pelvis. Now, Esraa and I, we've both taken this class. It's so, like, we're kind of nerds this way. We are. We love it. It's like so fun. But the thing is, okay, even if you don't know this, if you don't know where the baby is.
But let's tell our viewers. Okay, what is it?
There are stations. There are at the top of the pelvis is the inlet, and the baby needs to engage.
Can we show let's get the little baby pelvis.
The baby
out there.
actually needs to get into the inlet. And so when the baby's high, you could dilate. The truth is it's a bit of it goes together. As the baby's head goes down and starts to hit the pelvic floor, that's actually tends to bring pressure and helps it dilate.
But a lot of the times, like I've had a couple of clients that didn't dilate.
Right, exactly. So now the thing is that, they have to navigate this space. The baby has to navigate this space. And so this is the inlet. There are moves that we can do. Because the pelvis moves and your sacrum moves. So when we spend a lot of time sitting in a bed, we lock that pelvis. And
a lot of the birth prep has a lot of birth prep involves sacrum mobilization.
Exactly.
Yeah.
And so, but as Esraa started to say, just intuitively, you actually could feel like, oh, and they encouraged you though, which was great staff, is they encouraged you to do some kind of asymmetrical moves by bringing one hip up. Yeah. Because that actually helps as the baby's in the mid part. So that kind of.
Well, let's move back to women that are struggling to dilate, okay, and that are being, shot with quite a bit of pitocin because they're not dilating. Because I have rarely heard anybody talk about station.
It's very rarely talked about. You're right. And the thing is, this is getting to a medical.
And sorry to interrupt you again, but just for our viewers, station is the position. Like if you can just show us there. Yeah.
So, again, they may not remember all this, but there's going to be a negative as the baby's high. It's negatives, like a -3, -2, -1. Right around the pelvis is a 0, and as the baby gets lower, it's to positive. So even if you don't know, you're looking for positive signs for the baby to get lower.
Yes.
Now, the thing that the hospital has is medicine. Right? And sometimes we do need medicine. I'm not saying we don't. I'm thankful for when it's there, but it can get overused because if they show up and they're saying, oh, hey, your contractions aren't strong enough. They're going to be like, I can give you drugs to make it stronger. Their first thing isn't thinking about a physiological tool of what positions could we do. They're going to think about what drug I can give. And that's the kind of training that you and I both give.
There's smell, sounds, and sensation, right? So, you probably have a lot more experience than I do in the delivery room, but you would smell certain smells. You'll hear the pregnant woman, make certain sounds. And then you can also touch the sacrum to tell where the baby's station could be, right? So like, for example, if the sacrum is counternutated, you know that the baby is more in the inlet area, right? And then you kind of want to facilitate and get the baby to engage more. So we have tools that we could use to help the baby engage from the inlet into the mid-pelvis, right?
And for example, there are a lot of people I know. I met one lady who was like, I'm going to squat. I'm going to squat. Now, by the way, there's a lot of different squatting. And years ago, I remember thinking, oh, I want to squat. I want to open the bottom of the pelvic. So I was thinking I'm a squat. Now there's types of squats that actually narrow
The bottom?
narrow the top. Some squats actually, this is opening, but you can squat like this and narrow the inlet. And so I knew a lady who actually thought about using my classes and then was like, oh, I'm fine. She was very physically active and she was like, I can do all this, which I still think birth is natural. They don't always have to. But what she ended up doing is she just squatted. She exhausted her legs. And I really think what she did was she was narrowing the top of her pelvis.
Oh.
So, and this is actually where she was not being intuitive. She didn't actually even probably listen to her body. It was like, I'm going to do this. And there are movements. I mean, that's where if I was a doula, if I was your doula, I would actually wait and let you do movements. But if a woman wasn't moving instinctual, then there are movements that we could say, hey, let's try these.
Yeah.
So back to your story though, you got out and they made you do some like lifting the leg and kind of moving the hips.
But I think they based that on the sounds I was making, and they also based it on the
station.
The station.
Yeah. And so the station is very helpful. And and typically a station, one way to understand station is by a vaginal check. I mean, so a midwife or a nurse, and so, your husband wouldn't do that. Your doula doesn't do that. And like I said, there are clues that I get to by like how they're moving. So you mentioned like when a woman is in very upper early, they tend to move more forward and back.
Yeah.
And as the baby gets slower, movement that goes side to side starts to feel better.
Yeah.
But now I'll say that this is our training, but there are some times like I've watched a woman in birth instinctually do a movement that I might think, why is she doing that? But if I'm patient enough, like sometimes the baby's, let's say we want the baby to hear, but what if the baby's head is kind of
stuck on the shelf?
Yeah.
Yeah.
And so sometimes they feel it. They feel uncomfortable. So they just keep really leaning into the left. So I'm not going to sit there and go, actually, what we need to do right now is I need you to do hip circles. I'm going to be observing her and being like this. Now, one thing I would say again about benefit to what you teach and I teach is that if you've never practiced these movements though, if you've never done them, it doesn't feel accessible to you.
Right.
So when you take a class with us, when you do PT training, when you do childbirth classes, and we go over these movements, they start becoming accessible.
Yeah.
It's kind of like in your pocket, and then you might decide to grab it.
Because birth prep doesn't start during labor. Birth prep starts way ahead
of time.
Yeah, because what we want to do is obviously for people that don't know what we do, we will look at a person's posture and be like, okay, we are anticipating what potential issues this person could have based on their posture. Like if somebody's more hiked on one side or if somebody's got more of an anterior pelvic tilt, we'll know that, okay, when they're in labor, they might have issues in the inlet or the mid-pelvis or the outlet, depending on their posture. So then what we do while they're pregnant is we put them through a program so that we mobilize, strengthen, stabilize, adjust posture so to make more space and create more balance and space for the baby so that we're not because the acronym FBS, flow, balance, space, right? We want to work on balance and space way ahead of time.
Exactly.
So that when we are in labor, we can focus on the flow state. So that we can focus on creating that oxytocin surge, and then we've already prehabbed them for the birth, and then we can work with what they've got, and then help balance further, help create more space. So that is something that I feel is new. I think maybe you and I are the only ones that do this.
Yeah, and
Bahrain at the moment,
and it's stuff that we just. I mean, again, we're just always learning because you and I are just kind of like always like
we're nerds.
We're like always studying and always grabbing. It's like a little bit of addicted to keep growing, but that's important. Yes. But the thing is, I'm not saying your nurses and doctors don't know, but in some ways they hold, and I'm so grateful. They actually have to hold a lot of the medical training and expertise when things really start going bad.
Of course.
But like how you mentioned, like sometimes if a woman's like if a woman's not doing that great, we could put Pitocin, but a lot of times you're like, what if we started doing some of these movements?
Yeah. So I agree with you. There's definitely a time and place for these, for the Pitocin and
it might be. It's not always necessary because your body actually. I mean, did you take Pitocin?
No.
I didn't take
I didn't even
Pitocin.
take an epidural.
No, I didn't either. So it can be, but a lot of people make assumptions that, oh, someone has to break my water. Someone has to give me that drug.
Yes.
And actually realizing 80% of birth is incredibly normal and empowering.
Yeah.
Yes, I'm so grateful because I've been in a few births where I knew how grateful I was for their medical training. But I love when a doctor has a humble attitude of they stand like a lifeguard.
I don't want to undermine anybody else's story.
Yes.
You know, we have way too many negative birth stories in the world. I'm using my platform to share a positive birth story.
Yes.
Because you know what? The reason why I had a positive birth story, because I heard a lot of positive birth stories too. And I chose to ignore the negative ones, you know, but there weren't enough out there. But then when I dug through the social media and followed, you know, pain-free birth accounts and stuff, I was like, wow, there are so many beautiful births. I want that, you know? But what I'm saying is, again, I'm not trying to ruffle anyone's feathers. I'm not trying to, you know, invalidate someone's experience. This is my personal experience. But I was lucky too, you know? I believe luck plays a huge part. Genetics, luck, environment. There are so many uncontrollable factors within the birth space, you know, and I really want to stress on that, you know, that's my disclaimer, guys. You know, there is a lot of uncontrollable factors, you know.
But I also would say it's kind of like life. I think birth is like a God designed way to keep teaching us. Like there are so many of us want control over everything, and I think birth puts you in a little bit of humble.
Of course.
Place.
I mean, I didn't have the energy to think about what can I not control. I just felt, I mean, there were a few things. One, I made sure I connected with my baby, you know, and I needed to connect with my body. I'm very body aware as well. And I guess just doing what I do kind of helped me there. But making sure that, you know, I felt like everything was fine. Now, if I didn't feel like something was fine, that's a different story.
And that's also power. I mean, I've had women who've had very empowering stories that didn't go like yours or mine, but they did do what you just started to say there, which is being aware of what you can control.
Yeah.
And focusing on that, because some people, they have medical issues.
Yeah. And I empathize so much with them.
But still, I would say to them, there are so many things that they can focus on what they can control, even if you know you have to have a C-section. Yeah. There are so many things about this story.
And there's no shame.
No,
there's no shame in C-section. And I think it's very important because, I mean, we've been talking about vaginal birth this whole episode. And, you know, for those that opted for C-section, it's your choice.
And
you know,
but breathing and
even
movement
if you didn't
still
opt for it, even if it's like an emergency C-section, there's no shame in that, you know? At the end of the day, everyone has their unique birth story.
And there's still things that they can affect on how they engage in that space, both in their mental space, their breathing, and their attitude. And it's like you started to say, like, I knew I couldn't control everything. And that's going to be true in a totally natural birth with water near, is you can't control everything. No. But you still have some power. And so keep harnessing that. And that can be true if someone's like, I need this. I'm fine, but still remember, what can you still do?
No, I agree. One of the programs we have is called the Empowered Birth Program, and it's for pregnant women to prepare for their birth. And I believe that a major element of, and the reason why I called it Empowered Birth Program is because I think as women, we need to be empowered to make educated choices, right? Now, I don't want to give my power away.
Exactly.
Right? And I feel like by going into a pregnancy or into a birth ignorant of my options, my choices, it just makes it, I don't know, I'm giving my power away. I'm actually giving up control of things that I have control over.
Yeah.
You know? And I think that's one of the reasons why I opted for the word Empowered Birth Program. Empowered Birth Program is obviously for women that, want to aim for a vaginal birth. But you know what? Even if you get a C-section, or even if you choose a C-section, it still works for you because it's going to help you with your postpartum recovery.
Absolutely.
And I think that's a very important point to highlight here.
Yeah.
No, so back to my birth story. So it was around 4:20 when my water broke. I gave birth around 10:35 p.m., which is like 6 hours almost later. And I remember the midwife saying, 6 hours? Is your first birth? I was like, yeah, it was. And it was awesome because honestly, I'm not a very patient person. I'm not, and I feel like, how they say like God gives you what you can handle, not what you can't. And I think God knew I can't handle more than that. So he gave me what I could handle, and that was it. And then the birth came and I had one of my biggest fears was vaginal tears. And thank God I did not get any. But I feel like a lot had to do with preparation, also genetics to a certain extent. But like you said, education as well. So one thing I would love for our viewers, because a lot of people ask this question, and it's right here. Tearing concerns in labor, pushing and breath, holding the breath, pushing positions. Okay? That's a lot to talk about here.
It is.
So with regards to tearing, we both know that, your pelvic floor muscles aren't pushing the baby out, your uterus is, and your breath. And in our training, we were discussing the downward breath. So can you elaborate a little bit more?
Okay. So, and that what you just said is so amazing because I think you said something that I don't think a lot of people even ever hear. They're like, we hear of women who pushed for hours and they got black eyes. And so honestly, they weren't letting the muscle that needs to do the work, which is the uterus. The uterus is actually an insanely strong muscle and it wants to work, but you've got to, you said something earlier in your story, which I love because I think it's something, I'm not saying you got it from me, but it's something we talk about is that you don't want to waste your energy because a lot of people, they tense all this part of their body.
That was something that that was a quote from you during our childbirth class and it stuck with me.
And that's
don't waste energy.
Because the thing is, and what we mean by that is that if you're holding your hands like this, or you're fighting back at every contraction, that's a lot of energy that actually is stealing from the muscle that needs to do the work, which is the uterus. So the whole first part of the labor, the uterus's muscles are coming up. The whole second part of labor, the muscles are doing something else. And again, if we are breathing and relaxing, those muscles can do the work.
Yes.
Now, for me, this isn't quite answering your question, but let me just switch to this. About tearing, if I could give somebody a few quick things on tearing, is to think, if you could think about in this one, is some P's that I'm using, like how you did SSS, when like one of the P's is thinking about position. Your position, I would say way more than genetics, is the position that you push in. The standard position that we have seen for years, but was not
and
standard.
Being asked to push when you don't feel like pushing.
Right. So that's one of the other. So pushing and positions. So just the way you push, the positions and the patience are the things that would really help whether you tear. Because if you don't, if you're in a bad position, all the weight of the baby and your body is sitting there putting extra weight down. But if you can get the weight off, so if you were one knee up or on your hands and knees, so many things take the weight off the perineum. But also patience, like waiting for a sensation to push. Because it's a weird thing for somebody, a doctor, to tell you, hey, you're 10 centimeters, push. But if you aren't having that feeling,
that urge to push.
Actually can, you're working against the muscles. So, and that's
because the contraction helps the muscle lengthen as well.
It does. Yeah. And it's the one thing that another thing I would tell somebody is just patience. Is sometimes it's helpful to tell the doctors and nurses, like, we're not in a hurry. Now I know your story was amazing because sometimes it is faster, but sometimes the baby is moving, rotating, coming down. And as a woman is waiting for that sensation, sometimes people get birth in a hurry because they're just trying to get you through the system. They have somebody else that needs to use the labor room.
Yeah.
So, but just working, if you're trying not to tear, you want to get labor in positions that don't put all the pressure on your perineum.
Yeah.
Your position. Don't push when you don't have the urge.
Yeah.
And have patience.
Like I would say the most common pushing position is on their back, isn't it?
Yeah, it's on the
Where
back, or sometimes people kind of like this, like semi-reclined. Where like it's almost like that relaxing lazy boy position.
Yeah.
But you are still putting a lot of pressure.
And the sacrum is also counter-nutated. So can
exactly.
we just show our
you
viewers?
are causing this. You're like with when you are doing that, you're actually causing the
outlet to shrink.
To shrink. So you're trying to get a baby through, but when you're upright, maybe forward, this is out of the way and allows the baby to descend more.
Yes, absolutely. Let's talk purple pushing, and let's talk about the pushing from a position, from being on your back with a locked sacrum.
Okay, so a very traditional type of training of pushing is, and many of us who will listen to this, who've heard a doctor, they'll say, okay, I want you to take a big breath, hold your breath, put your chin down to your chest, look at your belly, roll your back, and push. And then they're like, great, keep doing that.
And that contributes to tearing.
It does contribute to tearing.
Yeah, it does.
It absolutely. And to probably more to DR as well.
Mm-hmm,
I mean, it's putting a lot of interabdominal pressure. That's a lot.
Pressure, yes.
So the thing is, then why are we doing it? Well, one of the reasons is it does work. Okay, it works to get the baby out. But getting the baby out is not the only thing we're trying to do here. Also, like that's what's
it's okay. So I was actually listening to a podcast the other day. Force over physiology.
Yep, absolutely.
And unfortunately, in the medical world, it's always force above physiology, because discussing this particular position where the pregnant woman's on her back, even if it's in a reclined position, her sacrum is tucked in, and her legs are out, which means there's external rotation of the hip, which makes the outlet even smaller. And then she is made to, again, use force to push the baby out, right? Versus if we're looking at it from a physiological aspect, we would probably recommend her to go on all fours, or maybe even get on her side. Or on her side.
Yeah.
Just to free the sacrum a little bit.
Absolutely.
And then we can manipulate the hip rotation and allow her, firstly, she needs to be in a comfortable position, whether it's on all fours or on the side but we need to free the sacrum.
Yes.
And we need to be able to have a rotation in the hip to allow for the outlet to increase in size, allowing the baby to come out. Now, force versus physiology. Now, I feel like we are in this current day and age. I think it's about time physiology starts to be taken into consideration with medical births. Like, I think it's about time, because it's not woo-woo science. It's physiology. It is science.
It actually is.
It's anatomy. It's not. It's not woo-woo science.
No. And it just, like when you talked about empowering birth, like that is something that when people can walk away and go, here's another thing that we gave some nuggets here. And that one can be, even if your doctor is telling you, hold your breath, do this, you can talk to your doctor ahead of time, which I would encourage a client to do, is saying, I don't want to do direct lead pushing.
Right.
Let me try for a while. Now, sometimes, and I will be there, I've been there. Sometimes there's a moment when they feel like the baby needs to be born.
Right, yes.
And they might say, hey, we need you to do a bit more aggressive pushing right now. And this is that mix between they are watching your blood pressure, they're looking at the baby's heartbeat, they're medically watching and hoping that none of those things are going wrong.
Right.
So sometimes they will direct a woman like, no, now we need you to push.
Right.
But I would encourage you is that they've gotten so used to doing that that they're pulling out, it's like pulling out the big guns before just saying, let her breathe. I mean, just think about that, holding your breath.
For it. That's the thing. It's like you said, they're looking at certain markers. Fantastic. Please do. We need you to, right?
Absolutely.
But also, I think it's part of their scope to also look at the physiological markers, because the physiological markers are dismissed completely.
Mm-hmm.
The only people looking at it might be mostly doulas, to be honest, and certain trained midwives.
But for example, the pelvic floor specialist may end up dealing with a woman who pushed too hard, too much later. Like, to the doctors, the OBGYN isn't dealing with that.
No,
The baby
not.
comes out and they're like, oh, everything's fine. But then you have a woman who has incontinence.
Yes.
And pain.
Or
and
prolapse
intimacy.
even, which is really hard to fix.
And those are all things that she's going to be dealing with after, whereas if she had not pushed so hard, and it may have even taken an extra half an hour.
Yeah, absolutely. So the next question I have for you, and I think this was by popular demand, the VBAC stories. How many VBAC deliveries have you?
Oh gosh,
have you done?
So I don't have my numbers. I'm bad. I would say I just want people to have confidence. I've seen so many VBACs.
But how many have you worked on?
I just don't have the number in my head. I've trained. And so I've trained a lot of people who are going to have VBACs, and I've actually been physically present. I mean, dozens.
Okay.
Dozens of. So what I want people to know is, if you've had a cesarean, a VBAC is possible. It is. Now, and there are a lot of reasons that they need to work through. And the first one is their doctor saying, hey, am I a candidate? But also finding a VBAC friendly doctor. Some doctors are not excited or even willing to entertain. And there's things that we would both help people do to consider, is getting them mentally and physically prepared. Because
there is a chance for disappointment as well. And I think that emotional trauma of that is a huge part.
Now, and I literally just had an amazing woman who hired me, and she wanted a VBAC. I don't think I've seen a woman work harder, to be honest. Both in chiropractor work, physio work, mental work, hiring me. I mean, she was like, I want a VBAC. Now, we talked deeply through the process.
Yeah.
But there were some medical reasons that her doctor, with love and kindness, said, listen, if you don't go into labor by this date, it's going to be a C-section. After she had her cesarean, and I was with her at the hospital when it was getting ready. So I, as a doula, I can be a part of the mental, physical through the process. And even later, like, everyone was telling her, oh, it doesn't matter now. Forget it all. You've had a baby. It is hard. And it's something that she and I just talked about. I said, listen, it is okay to grieve this and mark this.
Because one of the questions that one of our viewers sent was, here, I'll tell, where is it? Has to do with, how can expecting mothers navigate changes in their birth plans without feeling shame or disappointment?
It's so good.
And that is coming from someone I know that was really hoping for a natural birth and ended up with a C-section.
That's something really important that I teach through my classes, because life has changes. And for this lady, she'd done all this work, but we couldn't make labor start. You know what I mean? And it wasn't that her doctor was being mean. There were actual medical reasons that said, this is the end of the road. So when I'm teaching my class, and like what you talked about, the physiology, the physical work we're doing, it benefits you not for just having the perfect birth. It benefits your life. And the mental work that I'm teaching, you should be able to take these things in, even if your birth changes. One of my little sayings that we talk about with the affirmations is, I'm in control of what I can, and I let go of what I cannot. And so I think I'm, realizing that some of the things, I've had people just at that moment, and then sometimes we have to do a little post work just mentally, because you do have to navigate it.
Yeah.
But it's funny though, Esraa, think about you and I. We kind of had great birth stories. Did you feel guilty a little bit?
I did. I feel guilty all the time.
Isn't that weird?
I feel guilty even right now, doing this episode, talking about my positive birth.
Yes.
I feel guilty.
No, and I asked you that because
I'm not trying to rub it in anyone's face. I'm just.
And you feel like somehow, did I cheat the system? And then if you start telling people it's possible, but then they don't get it. And so.
Because I've heard fewer positive birth stories than I have negative.
So, okay, the good news is I've probably seen that as a physical doula, I've seen so many good stories.
Great.
But I've walked out of hospitals a broken person also, thinking, that was wrong. And I don't ever want to see that again. And I've seen women who felt like labor was like a truck that ran over them. And that hurts.
Would you say that the system could have avoided it?
Sometimes, and sometimes I don't know. Sometimes, and yeah, it's funny. I'm thinking back to a birth that was incredibly medically necessary. This woman had a lot of pre-existing medical conditions, and to the end, a scary almost end of birth where I've never, we were almost like, this could be she wasn't stopping bleeding. We couldn't stop everything. I mean, they couldn't stop. And all I could do was stay with her to help her keep breathing and relaxing. But you know what's funny about that birth? Actually, it was powerful. I had nothing to do that. It was very medicalized. But I think that the listener asked, is we do have to navigate. And it's funny, it's weird. They probably can't fathom that we feel a little guilty. But it's partly because also I know I did some things. I took a class, I prepared, but I have people who did that, So I don't have a perfect, easy answer for that, but I do want them to be able to navigate. And one of the things I do tell people is I want them to, when the time is right, they could sit back and think, what did I learn? I bet you they did learn things. There were moments that they were strong.
Yeah. I mean, that was thank you for sharing that. Yeah. Because I'm sure it wasn't easy, being that you were there and had to witness it as well. But I'm really grateful that, our viewers get a chance to hear it from you as well. I know you've got to go, even though there's so much more to say. And there's so many more topics and so many more questions. I mean, we might have to bring you back again. Yeah. But I really want to say thank you so much for, your transparency and your honesty and for everything that you do for women here, as one of, I would say, your clients as well. I'm very grateful for everything you did and contributed towards my positive birth story. Aww. And also for the work that you've done for women that have had, their own journeys as well, whatever the outcome might be. Because a C-section can also be a positive story, Oh
my gosh, it can so much.
Yes.
And I want people to hear that. Man, I've had people that hired me knowing they were going to have a C-section. Yeah. And people are like, wait, what? Yeah. Yes, but they haven't thought, how can, this is still a major life event.
Exactly. And I really wanted to kind of end well with that. And so that, our viewers have their answers questioned. And again, if our viewers have any more questions, please, share them in the comment section. Yeah. We would always love to answer them next time. Thank you so much, Nicole. And if our viewers want to get in touch with you, how can they?
There's two great places. There is on Instagram at birthwell.bh and also the website birthwell.me.
Thank you so much.
So proud of you.